Hi guys, okay, so this should be the last main video that I put for the series of how to do well on your sub-Is and psych rotations in general. We talked about how to do a good intake, how to write an MSE, and then how to formulate an assessment and plan. All, again, just my advice. Please continue to take advice from other medical students, other residents, fellows, and attendings that have done the rotations or is in the field, because that would only make you a better psychiatrist and a better medical student. But this was all information that I gathered from all my different rotations and all my different preceptors and mentors that I collated into one video. So thanks to them for all their help and advice, and I'm so glad that I can share it with you guys as you guys approach the opportunity to do psych rotations and hopefully become a psychiatrist yourself one day. So this video is going to be a little bit more relaxed. It's just going to be my kind of highlight points on what makes a good sub-I and how to do good on your audition and uh, audition rotations and just in general psychiatric rotations as well for third and fourth years. Primarily, I think this is going to be for fourth years because they're usually a little bit more nervous on what to do and how to do well on the rotations. But regardless, anyone who's interested in doing well on a sub-I, there's going to be general information about that. And for people who are interested in psych, there's going to be good information and resources as well. So I have a lot of different notes on this other screen that I have, so I'll make sure to try to hit all of them and summarize it so this video doesn't get too long as well. So the first thing that I wanted to talk about is just scheduling, especially for sub-I rotations, how to schedule them and what we should be doing when we're scheduling them. So again, this is just my personal view on doing these rotations, but I would say try to get as many psychiatric rotation, audition rotations as you can, because I think it's really hard to come by them, from what I was hearing during my year specifically. So it sucks when you have to reject a rotation, because it doesn't look good for many of the programs sometimes. But I didn't hear a lot of people having to do that during my year. Apply to as many places as you have genuine interest for, because that is definitely going to show on your letters to those programs as well as during your sub-I audition rotations. As for scheduling, my school recommended giving yourself 2 weeks to a month of doing a pseudo rotation just to get back on your feet after taking your boards. So normally what happens is people take their comlex or step 2 and then go into the rotations. And again, if you get a rotation that's right after your step or comlex, then take it, because if that's the only place it fits, that's the only place it fits, and you'll be just fine. But I personally didn't think I would need it, but ended up really appreciating having a little uh, intro again to rotations, especially before starting my sub-I. So I did 4 weeks of a outpatient slash virtual psychiatric rotation that just reminded me again how the intakes and interviews should look. And then I told my preceptor to also give me good feedbacks for when I get into my sub-Is, which was helpful during that time and kind of getting me warmed up. And then after that, what I did is the first 6 months, so from August, I believe, till January, or July till January, I basically did all psych rotations. And I did that for a couple of reasons, is because one, I really wanted to make sure that my psych knowledge was building on each other and there weren't really any breaks with other different rotations. If your schedule works like that, great. If not, no worries. I will say sub-Is are draining. So a lot of the times you're traveling, a lot of the times you're trying to be your best self, and there's honestly variable hours between sub-Is. It might be 8-hour days, it might be 12-hour days. So on top of that, you're also working on your personal statements, getting ready for your applications for residency. So it's definitely draining. So if you can get a break of a week or 2 weeks, that's also helpful as well, just to kind of reset between sub-Is. So that's how I did it, and that worked for me. Again, wherever you can get a sub-I, no matter where it is in the year, it would be great. I will say October and November and December, sometimes as late as even February, is when interviews start coming out after submitting your applications in September. So a lot of people try to find a chill rotation during that period where it's not psych related, so they aren't guilty for taking time off. None of my psych rotations at all made me feel guilty for taking a couple days off during that rotation to do interviews. A lot of people take wellness weeks or mental health weeks or 2-week breaks at that time to do their interviews as well. So it really depends on your sub-I and preceptor and how confident you feel telling them like, hey, I have an interview, but all my sub-Is and rotations were very relaxed with that and understood. So that's a little bit about scheduling rotations, which is a question I get so much and it's so variable between people. Just to highlight and summarize, I would say the big thing is one, make sure to schedule as many as you can that you're genuinely interested and passionate about in areas that you're interested and passionate about. And then two, don't be afraid that if they are during a specific time period, try to optimize the schedule that works best for you. But wherever they are, you're going to shine no matter what, so that's going to be okay. And three, make sure to enjoy and make sure to really have fun at your sub-Is, and that's going to be a point later. Okay, the next point that I wanted to make was how to approach your sub-Is and audition rotations. Uh, and that encompasses a lot of things. First and foremost, I think it's really important to understand what people are looking for when you are on a rotation, slash what I've heard people are looking for while you're on a rotation. Again, I'm a fourth year medical student, so I'm just coming out of this process. But these are a couple of things that I've seen and things that I tell third and fourth year medical students to kind of do when they're on their rotations. For a third year medical student, I would strongly recommend just enjoying and learning about the field as much as you possibly can. There are and I didn't know this at the time, and I look back now, I'm like, why did I think they're expecting so much of me? But in reality, they're just looking for people that are genuinely interested in learning about the field. And even if you're not interested in psychiatry or whatever rotation you're on, there's always something to learn from that rotation. There are things that I took from my OBGYN rotation, my PEDS rotation, FM rotation, and even surgery rotation that I applied to my psychiatric rotations that people complimented me on. Whether that's patient care, whether that's discipline, whether that's just working my butt off, all those things from other rotations was applied to this one and made me a stronger applicant. So for third years, just really engage and learn as much as you can from the rotation, doing the best you can, learning the most you can, and having a good attitude. And that's genuinely all they're looking for, from my experience. Now, for fourth years who are interested in the field, and you know that you're interested in the field or a couple of different fields, for psychiatry at least, make sure to come prepared with a couple of different things. One, that same good attitude. Uh, People, especially in psychiatry, are looking holistically at you, and sub-Is and audition rotations are a great place for people to interview you and learn more about who you are. So please, even if it's been a long day the day before, even if you had to drive a couple of hours, um, residency's hard and they're looking for people that they can vibe and connect with. And that doesn't mean you have to be this outgoing, extroverted person at all, but it just means that you have to be yourself, be kind, be humble, be gracious. And again, like third years, be really willing to learn and soak up all the knowledge you have as a fourth year. Be willing to be wrong and ask the questions. This is a point in your life where you can be wrong and it won't have an effect on the patients because you're going to have an attending or a fellow or a resident to help you. You're going to have all these people to guide you and really take that to your advantage. So ask questions, ask smart questions. Don't ask questions to look smart, ask questions because you genuinely want to become a better clinician at the end of the day. And that's why you want to know and learn more. Um, don't be afraid to give wrong answers as well. A wrong answer just leads you closer to your real answer. And if you are missing any knowledge or have any content gaps, definitely go back to your DSM-5, go back and read up on something you don't know about. And if the attending asks about it again, talk about, hey, you know what, I actually checked this up after the last time, and I had some questions about the subject, or, this is what I learned. Am I missing anything huge that you feel like I should know about this, whether that be medication management, whether it be diagnostic criteria, whether that be differential diagnoses, whatever that might be. So really just be willing to learn and soak up that knowledge and have a good attitude about it. Oh, the next thing, which kind of goes with the one I said previously, is really work as a team with everyone. Um, the type A people, you want to show what you can do and you want to do everything. And that's great, but remember that this is a team work and you don't want to overburden yourself with work and a patient load that you can't handle, and then the rest of the team has to pick up slack. You might be in audition rotation with other medical students from other schools, and you might be on audition rotations where there's going to be nursing students and PA students. This is an opportunity to really work and see how everyone works together to provide the best care for the patient population. And that's ultimately what you're there for, right? So work cohesively as a team. Ask if there's anything that you need to do, if there's some downtime. If there is downtime, take the downtime by all means, but make sure that you've exhausted all the things that you needed to do at that time period. Take your breaks, get to know the residents during those breaks, and the other medical students and PA students and staff and faculty. Treat everyone with kindness, no matter where they are or who they are, because when you're on an audition rotation, everyone, and I mean everyone, is looking and interviewing with you. And that isn't something to be scared of, because being you and being who you are should get you to the place you need to go. But that's just a reminder that, treat everyone with respect like you would anyways, even during the stressful time that it might be. You're also seeing what you like about the program, like about the environment in that program, like about how the residents are feeling as well, the support that the residents get, the location of the program. All these things are things that you can continuously learn about while you are in the program. Now, that doesn't mean that you should go and say, what do you like about the program? What do you dislike about the program? Kindly ask, what are some things that you feel like you would hope to see in the program in the next couple of years? Or what are some things that you really enjoy about the program? What are things that you expected or didn't expect that the program to have or doesn't have? It's just your opportunity to learn more about a program, is what I'm trying to say. So make sure to learn as much as you can about those programs as well. And then at the end, make sure to have a list of those programs that you subbed at or interviewed at, and have a Excel sheet about, this is what I really liked about the program, this is what I didn't like. So when it's 3 months down the road and you're looking at the program again, you're like, oh, you know what, I really liked that they had good residency wellness programs, but it was just far from home, or something like that. If it helps decrease some of the stress that, you know, they're looking to see if you're a fit, but you're also looking to see if they're a fit for you as well. Learn the system outside of the medicine of psychiatry and how it operates. Learn what different, what an IEP is, what a JB220 is. Go to some of the hearings as well, the Reese hearings. Learn about Tarasoff cases. Learn about what happens to patients upon discharge and what are the different areas that they can go to. Learn about different holds. Make sure you understand the legal aspect about psychiatry and ask questions if you don't. You're there to learn. And uh, being able to come up with a plan, including those things, is super, super helpful and makes you feel less confused when people are talking about it and you really don't know what's going on. So treating it like a job and like, if I don't know this, it's not going to help anyone, and really trying to soak up all that knowledge is super, super beneficial. Another thing to do, especially for people who are kind of on the fence whether they want to do psychiatry or another field of medicine, is keep a tally of what you really like about psychiatry and what you don't like about psychiatry, and if those things are something you're willing to go through and hardships that you're going to go through. For me, for example, I loved everything there was about psychiatry. I loved the patients. I love the medicine of it. I loved the history of psychiatry, how it's grown and advanced over time. One thing that, or a couple things that were actually really hard for me was the stigma with mental health and working on that, as well as some of the barriers that are faced by patients. And another thing that I was struggling with was how to not take the work that I see and the hardships that I see from patients home, because you do get to see a lot of difficult things, like any field in medicine, but something specific about psychiatry for me really hit harder and deeper than other fields. Make sure to ask attendings as well, like, you know, how do you guys work through stigma that happens in psychiatry, or how do you not take your work home in psychiatry? And that's where I got a lot of my best information and knowledge from, and I applied that when I was seeing patients, or I applied that when I was going home as well. So really figure out, what do you enjoy about psychiatry, what do you not enjoy about psychiatry, or what do you enjoy about another field or not enjoy about another field, and that should help you figure out, if this is the right field for you. Now, I know a lot of people that were 50-50 split, and that's okay. You apply to both, and wherever you end up is wherever you end up, and that's definitely okay too. Okay, the second to last thing that I wanted to share with you guys are some resources that I won't share my screen on for, but I just have listed on my phone. So let me get those up for you. So the first resource that I got from an amazing resident, and these are all online resources. I listed more book resources on my first video regarding how to do an interview intake at the very beginning. So I'll list some of those again in the description, but definitely talked about some of those more in depth. Online ones, be very wary about ChatGPT. That really came out when I started getting on rotations a little bit more, so I didn't use it much. I rather had used UpToDate, where I saw resources listed out for me from where the citations were, and I preferred that better. But UpToDate is a great resource, obviously something quick. Stahl's fifth edition Psychopharmacology is super helpful as well. DSM-5 TR online or DSM-5 handheld books are really good, just so you have those written down. This book, you can see it's kind of beat up, um, but this is my pocket handbook for interview guys. This is super helpful. Again, I'll list that down in the description as well. Other things that was helpful online, Psych DB. Now, Psych DB has all the criteria for DSM-5 written down in it, and then they also have specifiers for specific criteria, and that just elevates, especially if you're a fourth-year medical student, from just writing MDD or major depressive disorder to writing MDD with psychosis severe, or like just specifying all these diagnoses, or late onset major depressive disorder, and just specifying it makes you look more like a resident than a medical student. So PsychDB is a great resource as well. Psychopharmocopeia, which essentially had a lot of information on psychopharmacology. And what I used it for is that sometimes we were converting one SSRI to another SSRI, or one antipsychotic to another antipsychotic, or cross titrating it. And that's medicine that and math that I'm not really, used to. So Psychopharmacopeia really helps you do that easily. You basically put what medication you're starting with, at what dose, and what we're converting it to, and it'll shoot you out, you know, what the correct dosage on the other medication would be. And then another one that I used is DrugBank. Same thing, it has just a bunch of pharmacology data, side effects, things like that as well. Hippocrates is another great one that I use as well, just to see if how many drug-drug interactions might have with specific medications. And those two were really helpful for making sure I was choosing the right medicines and not missing anything, especially if the patient had a huge medication regimen already. The last thing that I would recommend is Doximity. Now, Doximity is great, especially if it's a busy day, everyone's using the phones that are on site. Doximity on your phone, you put in all your information, what school you go to, make sure you put in your ID information, and it will basically allow you to call patients and patients' families, especially for collateral in psychiatry, uh, on a pseudo number or a number that's associated with the hospital and not your own. So that was really helpful too. So I'd definitely recommend Doximity. It would always help in a pinch. And if you haven't gotten that as a third-year medical student, I would definitely recommend it as a fourth-year medical student. All right, and the last and most important advice, which is cheesy to say, but really, really, really enjoy this time. Fourth year, while difficult, is one of the best times in medical school. You're at the end of your medical school career. You worked 4 years for this, and no matter what your future looks like, really honing the fact that you made it this far and you're at the tail end of a very long journey and about to start a new amazing one. I know that this time could be stressful. I know that there's a lot of things to juggle during this time, starting from boards to completing VSLO to applications, and it's just a whirlwind of things. But please make this time to enjoy time with your family, with your friends, find some personal time for yourself. Psychiatry is a very, very holistic specialty from what I've seen. My application was nowhere near perfect, and I had the amazing opportunity to become a psychiatrist as a resident, and it is a privilege that I take seriously, and I can't wait to be working with patients in a place that I'm really, really hoping and knowing that I'm going to enjoy. So that is my big takeaway. Please enjoy your fourth year. Amongst all the things that you have to do, make sure to have fun, make sure to learn and grow, because these are formative years that are just going to shape who you are as a clinician, and why not get a head start and tackle it as a fourth year. So good luck to everybody. If there's any more important topics that you want me to cover, please let me know. Please reach out. I would love to cover them. But I think the 4 videos that I've made are probably going to be generally a good summation of everything that you need to know at least a bare bone level before you start your rotations. You guys got this, and again, all this information was at some level passed down to me by some psychiatrist or some medical student, as well as some tidbits of my own information that I learned over the years. So I hope this was helpful, and good luck to anyone, psychiatry or not psychiatry, third or fourth year, any year of medical school who is applying, and best of luck. Okay.